This is an example of a bandage you may have after surgery. For after an arthroscopic surgery, you'll be able to take the bandage off the next day after the surgery and shower. After an open shoulder surgery, such as a total shoulder replacement, you can take it off 2 days after the surgery and shower. In either case, once you get to that point, there'll be absorbable sutures under the skin in most cases, as well as glue over the incision that essentially makes it waterproof so that you can shower. So what you want to do is, the day after or 2 days after for the open shoulder surgery, you're simply going to take the dressing off like this all the way and peel it back until it comes all the way off. And this is an example where you may have an arthroscopic scenario where underneath you're going to find a non-adhesive bandage, and you're going to simply take these off as well and staying away from the actual incision sites. And then you can shower over this area, pat it dry, and afterward you can just simply put band-aids over each of those incisions. If it's an open shoulder surgery, you'll be supplied with new dressings that you can apply after the shower. In most cases, a sling that you have after a shoulder surgery can be removed several times a day, such as for meals and for shower times and when you do your exercises. And then after you do those, of course, you're going to have to put the sling on. Many people ask how you put the sling back on by themselves, and we're just going to show you an example of how to do that. The best thing is if you set the sling up at about the level of your shoulder, you can then simply unclip these little clips right here, and then you can take your arm and your elbow and set it right in, protecting yourself. You can see here. And then I'm not going to help here, and you can see that our model here can put the clips right back on. And then there's a band in most cases that goes around the waist, and you can simply reach back around and pull that. And then once you get here, you can use the arm on the, in this case, the left side to help you if you need to. Now, these slings oftentimes come with an option. This particular sling, there's a lot of different types of slings that you'll get to look at, but this particular sling comes with an option of bringing a strap across your shoulder, and again, you just simply reach back and bring that around. So there you have it. Once you have the dressing off, it'll be okay to shower, and what you'll want to do is, in order to reach under your armpit, you're just going to lean over to the side and create a space between your arm and your side, so that you can then take your opposite arm and wash under your armpit. In this way, you can do it without putting any stress on the shoulder repair that we've done for you. Afterward, you'll just put a new dressing on. Again, a band-aid in the case of the arthroscopic case, or if it's an open shoulder surgery, such as a total shoulder replacement, you'll just put a new dressing over the single incision that you have. Immediately after surgery, all patients can do what I call basic or core exercises. Again, these are started the day after surgery, and these are exercises that are going to be safe for everyone to do, and they're meant to both decrease swelling, minimize your pain, and to promote healing of your shoulder. So first, after you have your sling off, you can do neck stretches. In fact, you can even do those in your sling, and these are pretty basic. They're just neck to your side, and then to your other side, and then neck forward, and then looking up at the sky. Now, all of these exercises can be done as many times as you want a day. These are just meant to, again, promote healing and to maintain your flexibility in your other joints outside your shoulder. The next one is scapular retraction. And here what you're doing is you're going to basically bring your shoulders and go straight back. You don't want to rise up. You just want to go straight back and pinch your shoulder blades together. This is a very good exercise for making it so that your shoulder muscles don't get stiff in the back and in the scapular region, your shoulder blade region. We'll have our model turn around here and demonstrate that again. Just what he's going to do is pretend to pinch my fingers together. Again, not going up, but just going straight back and supporting these what we call parascapular muscles. The next exercise is elbow flexion and extension, and this is a non-resistive exercise. You can just go arm up and down, all the way up, taking your hand all the way up to your shoulder, up and down, again, as many times as you want a day. When you go through a cycle of those, you can then do wrist exercises. So going wrist up and down, Again, just basic, no resistance here, just going back and forth with your wrist. And then finally, hand squeezes. You can do these on your own, such as demonstrated here, or you can get a ball. You can get a racquetball from a store and squeeze those. The next group of exercises after shoulder surgery are intermediate exercises, and these are patient-specific exercises that can be used for certain individuals who have a higher risk of stiffness or in select cases. Okay, so again, these are going to be exercises that will instruct you on whether or not you can do. And the first one is the table slide. So what you want to do is you want to find something such as this, a table, such as the dining room table or a counter, where you can sit at a comfortable level. And what you want to do is you want to take the hand that was operated on. In this case, we're going to say the left hand, and you place that hand onto something that will slide across the table, such as a magazine or a book. And then you take the opposite hand, you put it on. In this case, you're taking the right hand and putting it on top of the left hand, and then you're simply going to push the left hand away from you. And you can see there, once it gets to the maximum point, you want to hold it for about 10 seconds, and that'll help you stretch. And as you get better and better at doing this, in order to extend the amount, what you want to do is you just want to lean your body into it so you go a little bit further. There you go. And then as you'll just come back up, you'll take a break, and then you can do the exercise again. And this is a closed chain exercise so that we're not swinging the arm away from us in the body, but it's in contact with the table the whole time, so it's a very controlled exercise that's safe to do and protects you while you're healing. The next passive exercise we'll demonstrate is passive external rotation. In this case, we're going to use a folding stick from a therapy kit, but you don't have to do that. You can use something simple such as a broomstick or a bat or a golf club, anything that you have at home. In this case, we're going to use the therapy kit, however, and we'll simply assemble this, and then we're going to have it in front of somebody. You want to lay down just like we've done here, and then the key is if you take a pillow and you put it under this right arm, in this case we're pretending the right arm has been the side that's been operated on, that'll support very well, and then the elbow is going to be right against the side here, so you don't want it out like this, you really want it straight in against the side here. You put the butt of the stick, or in this case our folding therapy kit stick here, and you're going to use that placed in your palm and take the opposite hand and push out to the side. So you see we're passively accomplishing external rotation, and all the movements occurring through the shoulder. It's not occurring through any other place. And like all these exercises, you go out to the side and you go and hold it for about 10 seconds. When it comes time to move into the more aggressive range of motion phase, the core or centerpiece of those exercises are going to be rope and pulley exercises and passive external rotation. Now here we're going to demonstrate rope and pulley exercises. And you can do these every day at home, and basically we're going to pretend here that the right arm is the arm that has been operated on, and the model here is simply going to take the left hand facing the door and pull that right hand straight up overhead. And again, just like all these exercises, you go to where you feel the stretch, you hold it for about 10 seconds, and you may start a little bit lower than this, and then you gradually advance, moving up. Once you're able to repeatedly get to the point where you're getting all the way up and maximizing out, facing the door, the next step is to turn away and face away from the door. So here you can see by facing away from the door, you can get a little bit more stretch going forward. As the left arm's brought down, the right arm can go even higher. We have boiled our shoulder strengthening program down to 4 essential exercises that are an integral part of your rehabilitation after shoulder surgery or in an effort to prevent shoulder surgery. Now, each one of these exercises is designed to emphasize a different part of the shoulder, and these are what I consider the minimum that you need to do after rehabilitation, either prior to or after shoulder surgery. First, we're going to demonstrate what we call biceps curl. So an individual here, in this case, we have an elastic band, and he's going to place this under his foot, and then as you'll see here, flexing through the elbow. The important thing here is that the elbow is staying right at the side, and all the work is occurring right here in the biceps muscle. The next exercise is the low row. This is a very important exercise. This is for strengthening the scapular stabilizers, which were very important in shoulder function. What we're going to do here is normally you can attach this to a door and have it pull away, but I'm going to hold this here so we can just demonstrate. And what you'll see is with his hand just above waist level, pulling straight back here, basically just pretending to pinch those shoulder blades together emphasizing those scapular stabilizers. Now we're going to show you a couple of rotation exercises that emphasize a different part of the rotator cuff. The first is internal rotation. Again, this could be where you're attached to the door here. And this hand's simply going to turn in to the side. Strengthen the internal rotators such as the subscapularis. Notice all the work's just occurring by rotation, the elbows staying very nicely at the side. And if you change your orientation, you'll be able to do the opposite of that external rotation. In this case, I'm going to move around him, demonstrate that for you. And again, the arm's now going to be going out to the side. Again, the elbow is staying nicely at the side so that all the work is occurring through the external rotators. If you have a therapy kit, what you'll be able to do is to basically gradually advance your resistance level by changing the band, or you can simply double up the band so that you then use the same band to have more resistance.